And host of Climate One from the Commonwealth Club. Thanks for joining us. Coronavirus can teach us about the spread of climate change. Both crises have global reach, visible perpetrators, and require aggressive early action for containment. But while an infectious disease is acute and deeply personal, the impacts of a changing climate are spread across different times and places. On the show today, we'll explore the connections between COVID-19 and the public health implications of burning fossil fuels that are destabilizing virtually every system around us, our food system, our water system, even political and governance systems. Keep an eye out on Twitter and our website, climateone.org, for future Climate One discussions on coronavirus, human behavior, economic disruption, and climate change. You can also listen to our weekly podcast wherever you get your pods. I'm delighted to welcome three experts today from the comfort of their homes. Brian Allan is Associate Professor of Entomology at the University of Urbana-Champaign. I had to look up entomology, I will admit, and learn it's the study of insects. He focuses on ecology of infectious diseases, particularly those transmitted via the bite of infected ticks and mosquitoes. He also studies the consequences of human incursion into remote ecosystems and how that is linked to diseases and climate disruption. Aaron Bernstein is Interim Director of the Center for Climate, Health, and the Global Environment at the Harvard School of Public Health. A pediatrician at Boston's Children's Hospital, he's passionate about the health impacts of the climate crisis on children's health and advancing the well-being of children around the world. Barb Gottlieb is Director of the Environment and Health for Physicians for Social Responsibility, where she guides national work on climate, energy, and air quality. She's the lead author or co-author of PSR's major reports on the health implications of fossil fuels, including Too Dirty, Too Dangerous, Why Health Professionals Reject Natural Gas, and Coal's Assault on Human Health. Welcome you all. Thank you for coming on Climate One today.
Nice to be here.
Yeah, thank you. Thanks for having us.
Aaron Bernstein, you said that climate and COVID-19 are bringing forward some fundamental truths that we're having a hard time staring out. Can you explain what you mean by that?
Well, I think what COVID is showing us is really that nature's trying to tell us something. Nature's given us a few shots over the bow here with emerging infections. COVID's the most recent example, but we've got MERS, SARS, HIV, pandemic influenza. These are all diseases that have come into people from animals. And if you look at these emerging diseases more broadly, it's the majority are wild animals. And so what ultimately is staring us in the face is the reality that we have taken advantage of nature to the point where we're putting ourselves at risk. And on top of that, we know very clearly what we can do to make a difference to prevent things like COVID. And among the things that really matter are climate solutions. And in fact, in many ways, pandemic solutions are climate solutions. And now is an important time to be talking about those.
So be specific. What are some things that could reduce pandemics that could also reduce carbon pollution and climate change? What are some of those co-solutions?
Well, a big one is deforestation. We think about tropical forest loss as sort of a moral crisis. What a terrible loss to everyone, and particularly to the species that are in tropical forests. But we know from many examples that chopping down forests increase risks of the spillover of pathogens from animals into people. We don't know that exactly with COVID, but in other bat diseases that have come out of bats, in Ebola, you may remember the most recent bad Ebola outbreak in West Africa. The evidence suggests that deforestation in West Africa actually may have pushed bats into parts of West Africa that they weren't in before. And as you may know, the most recent Ebola epidemic in West Africa was in a part of Africa that they haven't happened in before. And so, preventing deforestation is a climate solution. Preventing deforestation is also a solution to prevent disease emergence. Burning fossil fuels is another good example.
Yeah. Sorry, so burning fossil fuels is also a climate and a health thing?
Yeah, I mean, we know air pollution is bad for everyone's health in all kinds of ways. And the evidence we have suggests that, particularly with respiratory infections like COVID, and we don't have direct evidence on COVID, but in its first cousin, which was SARS, people exposed to more air pollution were twice as likely to die based upon the evidence we have. And so we have evidence that air pollution not only can make people sicker, but it may make people more likely to get infected with these pathogens as well. So burning less fossil fuel, which in China kills an estimated 1.6 million on an annual basis, may be contributing to the spread of diseases like COVID there and elsewhere.
Brian Allan, how do you see the connections between the spread of disease, as Ari just said, and the use of fossil fuels, the COVID and climate connection?
Yeah, well, I completely agree with Ari's answer that some of the drivers of climate change are also drivers of infectious disease emergence. And so land use change is a big one in terms of altering native ecosystems in ways that is exacerbating climate change as well as facilitating the emergence of novel infections in human populations. In terms of solutions, the problems are parallel in the sense that it requires large collective action that has to cross political boundaries, cultural boundaries, and result in an effective response that can limit the further spillover of infections that can cause pandemics in the future. And it will require a similarly large-scale response to tackle the problem of climate change.
Barb Gottlieb, I think it's fair to say that if you ask an average American person about climate change, they would think about smokestacks, maybe polar bears, maybe tailpipes. They wouldn't necessarily think about human lungs or personal health. Why isn't, if we just heard there's such a strong connection between climate and personal health, why don't more people think of it that way in that frame?
Well, I think some people are still thinking about climate change as something that's either out there or in our future. Those are the images that we were given early on, and they still stick. So you mentioned polar bears. I'm afraid polar bears might still be, for a lot of people, kind of the iconic image of climate change. But really, what we're finding is that more and more people are recognizing that climate change is real, it's happening now, and it's affecting their health. So polling shows us that. And I think also people's lived experience is telling them that. So if you lived in California and you lived through the wildfires, you know what the impact was on air quality, on health. And in fact, some of the particulate matter that was generated from those fires blew all the way across the country and reached Baltimore. Every region of the country is having its own climate impacts. In the Southwest, it might be drought and heat, which, the heat effects can be as severe as heat stroke, which can be fatal. The Midwest experiences extreme storms and floods with water contamination, impact on agriculture, and so on, all the way across the country and all the way through people's lived experience. I think the tide has turned. I think people recognize climate change as a real problem. More and more people are recognizing it as essentially human caused. And they're seeing and they're feeling the health consequences. I certainly know that the doctors in my own organization are seeing more patients presenting with symptoms and diseases that they can link to climate change.
And we'll get into a little more later about sort of the medical profession and their engagement on climate change. Over the past few weeks, we've seen increasing news coverage of how expanding our agricultural footprint can help lead to the spread of infectious diseases like COVID-19. So we should just cut back, right? Well, it may not be that simple, according to an article published last year in the journal Nature Sustainability. We spoke to one of the article's authors, Professor Jason Rohr, who told us population growth might make it hard to stop encroaching on wildlands, and climate change makes the problem even more complex.
In the next 70 years, 2100, we expect about 11 billion people on the planet. We're expecting to see about 10 to the 9 hectare increase in agricultural production to feed all these people, which is about the surface area of the U.S. I think that there's going to be some positives and negatives associated with disease. So I think if agriculture can outpace the pace of human population growth, then we might see improvements in nutrition. And nutrition is really important for fighting diseases. We expect to see greater contacts between wildlife and humans and domesticated animals and humans because of more people, more domestic animals to feed all those people. and a greater encroachment on natural areas that could increase the risk of transmission of pathogens from animals to humans. More people on the planet means that there's probably going to be more contacts among individuals, higher densities of people that can facilitate the transmission of directly transmitted pathogens. You're seeing this right now with the new coronavirus in urban settings where humans are densely populated. We may see reduced yields or need to make adjustments to where we're growing many of our crops because of climate change. So that could create a scenario where we're feeding less people with our current production. It's not clear whether climate change is going to increase disease generally or is going to cause shifts in the distribution of diseases or maybe increase particular types of diseases and cause declines in others. But I think we definitely need to be thinking about land use policies, and if we can facilitate feeding people without increasing disease, that is obviously going to be preferred.
4.
In the next 70 years, 2100, we expect about 11 billion people on the planet. We're expecting to see...
That was Jason Rohr, professor at the University of Notre Dame. A lot of really staggering points in there, particularly the idea that a area land size as large as the United States, Brian Allan, will be added into agricultural production. I don't know where an area the size of the United States is going to be added into agricultural production, probably from rainforest, tropical areas. That's going to bring humans in contact with species and disease. It sounds like more people, more food, more land, more disease. What can be done about that? Is Brian Allan?
Yeah, and further compounding the issue is that some of the land we're currently using for agriculture may become less suitable for production as well under climate change. So not only will we need more land to feed a growing human population, but some of what is currently being used may become vulnerable to climate shocks. It's going to be an issue that is going to intersect with infectious disease emergence, because we've seen a pattern where development of natural areas, typically for agricultural production, but also for timber extraction, harvesting of other natural resources, creates inroads into those areas that facilitate human wildlife interaction. And so, for example, in Central Africa, logging creates roads that allows hunters access to areas that were previously inaccessible. They hunt wildlife for not only for subsistence consumption, but also for a global wildlife trade. And those are the contacts between humans and animals that keep disease biologists up at night, because those are the best opportunities for spillover events to occur. So you have humans hunting wildlife, coming in direct contact with the animals, butchering and consuming them. We think historically this is the way many infectious diseases have entered into the human population. HIV likely got its start through human consumption of non-human primates. Historical Ebola outbreaks likely followed a similar pathway. So not only do you have this issue of loss of natural area to agriculture, but it also creates more opportunities for humans to come in contact with wildlife than they had before. Interventions will require, regulation, try to enforce laws against wildlife consumption and wildlife hunting, but also, culturally sensitive approaches that take into account that the reasons people are hunting bushmeat could be driven by lack of economic opportunity and lack of alternative sources of protein. And so try to address the actual problem that's leading to these behaviors in the first place.
Barb Gottlieb, if population is the ultimate driver of this, is physicians' responsibility looking at contraception, women's empowerment, family planning, that sort of thing as an ultimate driver of climate change may be a medical and family planning issue?
Well, as it happens, Physicians for Social Responsibility doesn't take up those issues directly, although I know that some of our colleagues and allies do. I think that Brian was really right, though, in pointing to some of the social factors that really determine the impact or the gravity of some of these apparently natural phenomena. Here in the United States, I think we're really looking much more at issues of social justice and how those play out and how those impact things like who's consuming fossil fuels, to what purposes, and what are our alternatives in terms of our way of life.
All right, Bernstein, one of the other points in that clip from Jason Rohr was the increased urbanization in the world. We know that the world is urbanizing very rapidly. That's good for climate. People who live in cities have lower carbon footprints than people who live in rural areas, drive longer distances, takes more, for services, et cetera. But watching that, hearing that, think that increasing urbanization is also good for diseases who like to spread quickly in urban populations, as we're seeing with COVID-19. So is there a clash between urbanization and sort of disease prevention or disease response?
Yeah, it's a good question. A lot of people are scratching their heads about the wisdom of everyone moving to cities these days in the face of COVID. And, I think these issues are somewhat separate. It turns out that, with things like COVID and even Ebola or other recent emerging infections, cities had a role in spurring their spread. But, the primary fault here is not in urban existence. It gets back to the points that Brian was raising earlier, which is, the infections are getting to people usually outside of cities, usually in forests, sometimes in agricultural livestock settings. And, it turns out that, city dwellers in the United States may have opportunities to lower their carbon footprint because they're not as driving as much. But, it's hard to say that that's true across the world in all cases. And it really depends on how we design our cities. And one of the things that COVID reinforces is how important surveillance is. Many folks have already talked about the need to do healthcare system strengthening as a core part of dealing with pandemic preparedness, so that we can both detect and help treat those who may be getting infected first. So I think we have to focus on the issue of urbanization and all it can afford us in terms of carbon and other sustainability concerns, and also recognize the other issue, which is how we're doing business with the biosphere, and optimize both.
When you say surveillance, I get a little thing inside me that gets a little my creepy detector comes up about when you say surveillance. I think of how intrusive China has a surveillance state right now and facial recognition. So should I feel uneasy about disease surveillance? People are going to be on the street corner asking me for a blood sample to see if I'm diseased.
Well, if disease surveillance in the form of trying to find pathogens that may be in bats and where they live is creeping you out, then yes. We had in this country a pretty good program called Predict that was designed to, essentially find a needle in a haystack. And they found lots of, as an example, coronaviruses in bats over the span of a decade. And for reasons that now increasingly are hard to grasp, not just because we're in COVID, although being in the middle of COVID doesn't help. Having known already that emerging diseases were more common, they were coming from wildlife, that program was given the axe. And so
that's a CDC program that started around 2009, right?
it was a USAID AID program started in 2009. Right. And we need to know, we know to many orders of magnitude below zero the composition of the Earth's atmosphere, the gases. We know the distance from Earth to the farthest distant planet in our solar system in excruciating detail. We don't know to an order of magnitude the number of species we share the planet with. And our ignorance of the life we share the planet with is, again, coming back to the reality that we operate as though we can transform nature. We can, totally transform the climate, change the biosphere in a way that hasn't happened in 65 million years since an asteroid struck the planet and wiped out half of life on Earth, including the dinosaurs. And that's not going to matter to us. And that's the most dangerous delusion of this hour, which is, and nature's trying to tell us that. That's what nature's trying to tell us. And the good news is, and these population projections and the food projections, we need to take seriously. But really, all of that you don't need to recognize that to meet the health concerns that we face right now in the world, take obesity. Obesity is a consequence of unhealthy diets. And we can make diets healthier and get at the root causes of climate change and a whole suite of other problems at the same time. So it would be one thing if the solution on the table was going to be a real trade-off. But the reality is that it's not such a hard trade-off. It is hard to do, but the trade-offs are not as are very much weighted into the things we need to do.
If you're just joining us, we're talking about COVID-19 and climate change with Ari Bernstein, a pediatrician and interim director of the Center for Climate Health and the Global Environment at the Harvard School of Public Health, Barb Gottlieb, director of Environment and Health at Physicians for Social Responsibility, and Brian Allan, associate professor of entomology at the University of Illinois at Urbana-Champaign. Barb Gottlieb, you're doing work on trying to engage health professionals who are not taught about climate change in medical school to engage as messengers as climate as a health issue. So tell us how you're trying to engage doctors and nurses to be climate ambassadors or climate advocates.
Sure. We do this we do this really in three ways. The first thing that we do is, of course, education. We train health professionals on issues that, as you're saying, they didn't learn in medical school, whether that is what are the causes of climate change or what are its health implications. And then we produce educational materials ranging from handouts to white papers to virtually encyclopedic compendia of information on the health impacts of fracking. And because health professionals are the ideal translators of scientific information. We know that they're very trusted messengers on all issues of human health. And certainly, I think Anthony Fauci is the living proof of that today. A lot of the health professionals we work with do similar kinds of roles, translating the scientific material into what does this mean for my family? How could this be affecting my health? And most of all, what can we do about it? The third thing that we do is we actually, and it's funny that you use this frame, we have a program that we call climate ambassadors, and these are some of our very best, most knowledgeable, and also most proactive volunteers, and we use them to bring these health messages into the public sphere. So sometimes what they're doing is they're writing articles for the newspaper. These could be op-ed articles, or sometimes it's something as simple as a letter to the editor that's talking about what does sea level rise mean for my community? Why are there floods with full moons in the city of Miami? What does this mean for health, and what can I do about it? They also engage more directly in policy advocacy. That's the second area that we work in, because as trusted health messengers, they really are the right people to show how taking action on climate change is possible, it's feasible, but to have the adequate impact on the planet that we need, it really has to be at the level of policy. And so our health professionals may visit their members of Congress. They may testify before the EPA at public hearings. We even have a lawsuit currently against the EPA on a question of limiting methane leakage from oil and gas wells as one means of slowing climate change. And then another thing that we do is to push so that the future generations of doctors and nurses are better educated on these issues. So we're pushing for the inclusion of climate change in medical school curriculum. We've achieved that in small measures in some schools like the University of California in San Francisco, University of South Florida. And most excitingly, one of our members introduced and championed a resolution that was eventually passed by the American Medical Society, the American Medical Association, the AMA, calling on medical schools to introduce climate change all throughout medical education, including the ongoing medical education of doctors.
I remember during the climate march in Washington, D.C., seeing healthcare professionals being very vividly in their scrubs marching down near the White House and the Capitol. Ari Bernstein, what Barbara's calling for is kind of politicization, or might be outside the comfort zone of people leaving the clinical setting to get into the political ring. Is that something that you see doctors willing to do? Is that something you're willing to do? Go out in the streets or march, or go? I know you've testified before Congress, probably.
Yeah, I think it's a really important question because we have to acknowledge that climate change is politicized. And I think one role that people in healthcare can have is helping to depoliticize it, because it really isn't a political issue as to the nature of the problem or what's at stake. It's a scientific matter. And so to get people on the same page that we're facing a health problem and that the actions we need to take are actually really important to improving people's health right now, there's no question. I would agree with Dr. Gottlieb exactly that healthcare providers have a critical part of that. I think it's important to recognize as well that when it comes to climate change and health and engaging the medical community, and I'll speak for my own kind, but this, obviously includes nurses and all those who are in the front lines of care provision. We have to do a better job of making the case that climate change isn't just a health issue, which it is, and that it affects large populations and it's bad for asthma, it's bad for infections. We have to make it a matter of medical practice. We expect clinicians to take this issue seriously beyond their personal lives, to take it really as a professional concern. We need to make the case that it is, in fact, affecting how we do our jobs. And so we partnered with the New England Journal of Medicine, the Harvard Global Health Institute, Sea Change in Harvard, and launched a series of symposia. We had the first in February, which really are intended to make the case that this is a medical issue. It's about how doctors prescribe medicines. It's about our ability to do our jobs. And it's about the quality of care that people expect to get in the United States. And we hope that through showing these clear ties to the delivery of care that really get into the day-to-day lives of how nurses and doctors do our jobs, it'll give ever more reason for folks in healthcare to speak up and to make clear that we really need to take climate action if we're going to continue to practice and do our jobs.
Brian Allan, it's hard to remember now during COVID, but I certainly remember the Zika virus was sort of gradually marching north. And I've seen into Florida, and I've seen maps that show the Zika boundaries well into central California. You study the transmission of diseases through mosquitoes, ticks, et cetera. What are we looking at in the future of a climate destabilized world? How we will be vulnerable to new diseases that, I don't know, malaria, we thought we banned from California, but it's coming back.
Yeah, the impacts of climate change on infectious disease is complex. And so it's one of the big challenges in our field is to try to understand the different pathways by which a changing climate can alter the transmission of diseases that currently affect the human population, and also try to integrate this with efforts to predict future infectious disease emergence. Mosquito-borne diseases like Zika virus are often put forward as some of the best candidates for diseases that may be exacerbated by climate change. And I think that's a reasonable concern for a number of reasons, but one is the expanding northward distribution of some subtropical mosquito vectors like the mosquitoes that transmit Zika, dengue virus, which currently occur in portions of the southern US. And you're absolutely right if you think back to a time when these did not occur, because there were previous periods when these mosquitoes had been greatly reduced or even eradicated from some areas. And so we're seeing reemergence of mosquito-borne disease, in part because of recovering populations of those mosquito species.
Is the US healthcare system prepared for the onset of these kinds of climate-related threats?
Yeah, I think it's a system-wide challenge, right? So you have diseases that are typically thought of as being travel associated or being associated with the tropics that I think the US healthcare system has not really had to grapple with at any large scale. I think we can also see this as kind of compounding in terms of health effects. So some of the same health impacts from climate will be driven by other factors like changing air quality and increasing heat stress. And so I think we can expect, the health system to be increasingly stressed by these types of climate-induced health problems, along with everything else we're grappling with, say, during a pandemic like COVID-19.
All right, Bernstein, what do you see as the biggest looming climate-related public health threats? Water, heat, et cetera.
Yeah, there's plenty to choose from. I think to pick up on something Professor Allan was saying, there's a lot of interest in understanding what climate means for infectious diseases, and especially if diseases transmitted by mosquitoes and ticks, and we need to know much more than we do. But you don't have to know anything other than climate change puts at risk things like water and food. Those are probably the two most important consequences, and that's as true in the United States as it is anywhere. And there's, between the droughts and the saltwater intrusion and fires burning up crops, heat, wilting crops, etc. it's going to make people move. And that's what we're seeing now. You look at population displacement, people being forced to move against their will. Those folks have plenty of infectious diseases. And so we tend to think about climate change affecting insects, which is understandable because insects are subject to where it's hot and cold or wet or dry. But even if we didn't have that, we'd have huge numbers of people. And by huge, if you look at the Syrian refugee crisis, we often don't talk about the folks showing up on our southern border as climate forced refugees, but in fact, a part of what's driven folks to move from Central America are extreme droughts. You look at these numbers, we have more people displaced from their homes in the world right now than at any point since World War II. Many of them are children, and they have huge health risks, not just infectious. That poses national security risks and conflict risks internally. So, we often get into these conversations about, how bad is this? Well, I'm sort of done with those. Uh, I think it's time to really help get people on board with the reality that the things we need to do are not just critical to giving our children a future that's livable, but that they're going to get at the health problems that I, as a pediatrician, for example, have a really hard time dealing with today, namely things like obesity. We know that, high red meat, processed meat diets are extremely unhealthy, and they're also very carbon intensive, and eating more plants, less carbon intensive, healthier. We know that exercising more, active transit, all these things are going to help with BMI. And mental health. So we have a huge problem with mental health, both incidence in the United States as well as treatment. And we have ever more evidence that air pollution from burning fossil fuels contributes to mental health burdens. Heat contributes to mental health burdens. We know that green space can potentially prevent mental health conditions. And there's studies looking at children over a decade showing that those that have more access to green space, when you control for many things that would increase risk for mental health, have way less mental health problems. And so it's just staring us in the face. These are things we need to be doing anyway, and we would benefit from anyway. We're going to spend 2.4, I think it's maybe more now, $1 trillion to deal with COVID after the fact. The kinds of conservation that would be required to protect the biosphere of an estimated $100 billion, $110 billion a year, we would get 20 years of protecting half the habitats on Earth, which would include the forests that are causing deforestation, causing climate change, for a fraction of the cost of what we're spending now after the fact. And that would come with enormous health dividends for people right now that we can seize upon, that these things don't happen in 10 years or 5 years. You stop burning coal in a power plant or burning gas in a car, people lead healthier lives the next week. And so I just see the immense opportunity here to take actions that are both going to provide for a healthier present. They're going to potentially buffer against pandemic risk. And of course, they're going to give the future that we really want our children to have.
An ounce of cure. One reason that the financial incentives may be a big reason why we're not doing things that they kind of make sense. Ari Bernstein, you mentioned an accountable care organization. That was a new term to me when you said that, and then I looked it up a little bit and thought about, it's kind of like Kaiser or Mayo, where institutions have a financial incentive to invest in someone healthy today, so that that company will accrue the future financial benefits of that person not getting sick down the road. Is that right?
Yeah, I mean, right now, people often ask, why don't we do more in medicine to keep people healthy? I mean, we've got a $3 trillion healthcare bill every year. It's roughly 18% of GDP. Depending on where you look, the lion's share of that is preventable. Why don't we prevent all this disease and use a couple $1 trillion to do stuff we actually want to do, like give our kids an education? And the honest answer is doctors aren't incentivized mostly to keep people from getting sick. And so that needs to change. And COVID is a really good example, because how sick you get from COVID is largely dependent upon your age, and also whether you have a pre-existing medical condition like obesity or heart disease, which is overwhelmingly caused by things like smoking and unhealthy diets. It couldn't be clearer that prevention is worth a lot. And so these accountable care organizations in some places have been able to capture some of the value of preventing disease and sort of engaging healthcare systems with their communities to do, stupid stuff, frankly, which is like improve insulation in homes of people who are housing insecure, so that they don't have to pay as much in their energy bills and may not get kicked out of their homes because they can't afford to pay for them. And we know that housing instability is a major determinant of ill health. At the same time, of course, when homes use less energy, because most homes are heated in the north by some form of fossil fuel, we're putting out less carbon pollution and we're putting out less air pollution that is going to drive those same families to go to the hospital. And so there are inklings of opportunity here, but we need to accelerate this much more. We need to recognize that this healthcare bill is really crazy, and that we don't have to do it. We simply have to align our ducks in a different way. And that, that's a call to how we as a society want to operate. Not an easy challenge, but I think if we can make clear what's at stake for people's health right now, the opportunities, nobody wants to go to the hospital. I've yet to meet anybody who really wants to be in a hospital or see a doctor, frankly. And if you do, we need to talk because it's not good. But these are things that I think we can get folks behind. And in most circumstances, they're also climate solutions.
Bob Gottlieb, Physicians for Social Responsibility, has 30,000 members around the country, many of them part of and benefit from that fee-for-service medicine model. I'd like to hear your response to what Ari suggested as kind of changing the economic incentives for the healthcare system for better health and for better climate outcomes.
Oh, I think we couldn't agree more. I like to say that Physicians for Social Responsibility has kind of the cream of the crop among our membership. The doctors, the nurses, the technicians, all of the health professionals who are members of our organization, I think are motivated by really deep, profound concern about people's lives, people's well-being, and how we as a society are meeting them. I don't think they're in their profession for profit. And in fact, we would love to see some really sweeping changes in the way health care is organized and provided in this country. I'd also like to underscore one of the other things Dr. Bernstein was saying, which has to do with the importance of prevention rather than treatment. We're finding that treating the COVID-19 pandemic is extremely difficult. Well, it's going to be more difficult or virtually impossible to treat climate change. You can't treat climate change. And yet, the kinds of prevention that need to take place are not really in the medical realm. We really have to look at these larger questions of how our society is powered, if you will. And I guess I mean that in both senses, both in terms of our use of fossil fuel, and then in terms of how power is wielded through our government structures. We need our government to be much more responsive than it is now to recognizing the connections between unhealthy fossil fuels, unhealthy population, and a really endangered future for our younger generations.
All right, Bernstein, there's something there which is treating climate change. COVID, as bad as it is, we know it will pass. It may be a year or two. Climate change is permanent and is only going to accelerate. So as anxious as people are right now about when's this COVID going to end, climate's not really going to end. So I'd like to hear you on sort of, there's an end to COVID, but climate, it's not like the end is a different situation.
Yeah, I think it's important to recognize, and the clip you rolled, I think, made this clear, is, we're a weedy species. We know how to adapt to things pretty well. The problems we face in climate change is it's abundantly clear already that, and as you alluded to, an ounce of, you get a little bit of prevention is worth way more than any amount of after the fact actions. And so what we need to do now is recognize that we have a window of opportunity to really flatten the curve when it comes to climate change. And the other side of it is the equity piece. So as with COVID, any of these, health crises, and climate is very much a health crisis, it just amplifies the inequalities in our society, and that doesn't work for anybody. It especially doesn't work for the poor, but it doesn't work for anyone. And I think that's what's becoming grossly apparent now. And you talked about how, the climate is going to be changed for a long time, and that's absolutely true. But I want to underscore something that Professor Allan said earlier, which is, we can adapt to the climate, and we might even help some of our fellow species adapt to the climate. We're trying to figure out how to save species from climate change. But the reality is that once a shred of the fabric of life is gone, once we lose a piece of the biological diversity on the planet, it really is gone forever. I mean, people talk about cloning woolly mammoths back into existence, and maybe one day that'll happen, but it may not work very well. And so we have to recognize that while we're immensely and understandably distraught right now about a disaster in front of us, and it's causing as much damage to our health as it is to our economic wellness, the GDP effects and the Wall Street effects, even the healthcare effects, as enormously painful as they are, we can, we're going to find a way, as best we can through this. We're going to lose a lot of people along the way. But it turns out that with the biosphere, that's not possible. And we also don't have another planet to go to. And I think that's why, as a clinician, there's a particularly important role for us, because it's like taking care of a patient. We recognize that, if I have a baby that I'm taking care of who's a month of age or less, that baby has a fever like the planet. I don't presume that everything's going to be okay down the road. I know, based upon evidence, that there's about a 10% chance that there's a bacterial infection causing that fever. The vast majority of those are from urinary tract infections. Those are bad. They're not necessarily life-threatening. We got some time, but there's a small percentage of them of bloodstream infections and meningitis that'll kill that child. And so what do? Well, even though the chances are probably around maybe 1%, we do all the tests we can possibly do to make sure there's no bacteria in that child's body. And we give antibiotics before we know the answer. Why? Because waiting for the answer is malpractice. We would be sued. Well, think about that in the context of the planet. Right now, we have one planet, last I checked. And we know that biodiversity is disappearing, as I alluded to, at an unprecedented rate. The climate is being pushed to a place that we, frankly, have never survived. And that looks a lot to me like an infant with a fever. And so, whatever the badness ahead is, and we can talk a lot about how bad it's going to be, but it's pretty clear it's going to be plenty bad to justify doing the things that we already know how to do right now to get rid of the problems that are already affecting us, even if climate change weren't happening.
We're going to go to our news quiz here for the Climate One conversation about COVID-19 and climate change with Brian Allan, professor of entomology at University of Illinois, Urbana-Champaign, Aaron Bernstein from the Center for Climate, Health, and the Global Environment at Harvard School of Public Health, and Barb Gottlieb with Physicians for Social Responsibility. First, for Brian Allan, how long does COVID-19 live on hard surfaces?
Oh, it depends on the surface. From the data I've seen come from the CDC, maybe something in the neighborhood of 24 hours on cardboard, maybe 2 to 3 days on plastic or stainless steel, probably shorter amounts of times on fabric.
Yeah, nailed that one. Barb Gottlieb, how much money have the world's governments and central banks pledged in stimulus to counter the economic shock of the virus?
Not enough?
7 trillion and growing. It's mind-boggling numbers. Aaron Bernstein, the governor of which state with some of the highest per capita cases of the virus has been criticized for botching the pandemic response by insisting, quote, "Our state is never going to be China"?
Can I ask something of you before I answer that?
Sure.
What if we get it right?
We'll put in the applause soundtrack from the audience. Yeah.
I was hoping to have your voice on my voicemail message.
I'm not. Who's that? Yeah. Is it Carl Castle or Paula Poundstone? Can you imagine Paula Poundstone?
I will freely admit not only do I not know, I'm not going to guess, because the last thing I want to do is put a governor in that position.
So it's Mississippi Governor Tate Reeves, one of the last states to also to put in place a shelter in place order. Barb Gottlieb, which government agency has suspended all operations for the first time in its 60-year history due to coronavirus?
All its operations. Of course, I'm most focused on the freeze on operational implementation by the Environmental Protection Agency. I'm not sure that's the one.
The Peace Corps has ceased
Uh,
operations for the first time. Um, Dr. Bernstein, name the drug also used to treat lupus, malaria, and arthritis that some studies show might be effective in the treatment of coronavirus.
So I object to the question, but you're looking for hydroxychloroquine. And the reason I object to the question is because there is one study. It was not exactly a study that would say anything about whether hydroxychloroquine would or would not be uh, effective at treating the virus.
So that could be one of the many myths or bunk information floating around
I
in
mean,
this
we don't,
swirl.
I think the fair answer is we don't know. We do know the drug has risks. What we don't know in this instance is whether the drug has benefits. And I just want to emphasize, and this is an equity piece, and it's worth saying, because we see people of means hoarding drugs, which in my view is irresponsible. And many of these drugs, I'm sorry to say, are being prescribed by clinicians, medical doctors in this country. And those drugs, like hydroxychloroquine, are life-saving for people with diseases who need them. So before we go on a binge on drugs, which we do not understand whether or not they are safe or effective, we need to recognize that there are people who need those drugs right now, and they're very effective. So can we please do that? Can we please, as providers, prescribe medications for the people who need them and not for those who are better off, who frankly, we don't even know if they're going to benefit?
Yeah, thank you for sharing that. There's this sort of hoarding impulse, this fear impulse that's driving a lot of these reactions is, yeah, troubling to see. Brian Allan, this is true or false. Brian Allan, the U.S. banned travelers from China from entering the U.S. early on in the crisis, one of the few moves by the Trump administration that's been applauded by experts. Um, yeah, true or false?
Depends on what you mean by early in the crisis, but it is true that there was a ban on travelers from China.
Dr. Bernstein, the United States, true. Yes. Dr. Bernstein, true or false? The United States is now testing 100,000 people a day. It has tested the most total people and the most per capita.
I know the first part is true. I'm not sure about the last part,
Yeah,
but
this
I'll
is
say
one of
true.
the first part is true, but not the most total people per capita. We've tested approximately 1 out of 273. South Korea has tested 1 in every 119. Germany 1 in 90. So that's one of the ones that's not so true coming out of the White House. Brian Allan, as the world comes to a standstill, there have been stories all over the globe about blue skies and clear water not seen in decades. One story even shared that dolphins had returned to the canals of Venice. Is this true or false?
I believe the particular anecdote about dolphins in the canals of Venice is false. There are some indications that air quality has improved as a result of downturn in economic activity.
Right, and the water's clearer in Venice, but not the dolphins. Um, Barb Gottlieb, who suggested that people over 70 would be willing to give their lives in order to save the economy for their grandchildren?
Oh, I think was that the governor of Texas suggesting that he and he would be willing to do the same, and he assumes that others like his parents or his grandparents might have done the same. So we should all be willing to step up like that.
Lieutenant Governor of Texas, Dan
Lieutenant Governor, thank
Patrick,
you.
said he's willing to is willing to exchange your survival for keeping America that all America loves for your children and grandchildren. If that's the exchange, I'm all in. Also, a person who said he thinks that climate has been in the hands of God for a long time, and he wants to leave it there. Aaron Bernstein, which White House advisor made an appearance at the press briefing recently to clarify that the federal stockpile of medical supplies is for, quote, us and not the states?
That's Jared Kushner.
Correct. Brian Allan, the biggest annual climate conference, the Conference of Parties 26, was scheduled for November, was postponed until 2021. Where was it going to be held this year?
Oh, I'm not sure.
Glasgow. was where it was going to be held. Last one, as of early April, how much of the world is under stay-at-home order, Barbara Gottlieb? How much, as of early April, how much of the world is under a stay-at-home order?
To be honest, I do not know what that percentage is, and I think we could all wish it were higher.
50%, according to the New York Times, as of early April. Last one, who can guess this? Which former NBA basketball player is currently negotiating with Chinese manufacturers on behalf of Brooklyn to purchase 10 million N95 masks? Any guess? Anyone? Stephen Marbury is negotiating. It's kind of a funny thing. I think something similar happened, Ari, in your neck of the woods, where you have sports teams kind of doing deals directly with China to bring things in.
Yeah, I think a lot about what my grandparents would have said if they had heard that we're depending on Russia for medical supplies.
Right, and relying on professional sports teams to secure and star athletes to secure. Ari, I'd like to ask you about this. As a pediatrician, how do you talk to children about something as scary as COVID and climate?
Yeah,
very scary time.
It's it's a good question, and pretty much every parent I can imagine, and certainly every parent I know is dealing with that. I think one of the things we've learned is that children are not idiots. We have a habit of trying to shield them from things and pretending they don't understand. And the first point is that it is important to talk about it. And I think, being clear, saying that, there's an infection. Most children get the infections. They've had ear infections. And that we're doing all of these things. We're asking you to wash your hands more. We're asking you not to go to school. We're asking all of this. And I think this is one of the critical parts of it. And frankly, our children teach us so much about how to behave in crises like this. We're doing all this not just to protect our family, but more importantly, we're doing it to protect the people in our community. We're doing it because we have a responsibility to take care of the people around us. And man, there is not a child I've ever met that doesn't get that. And what's amazing to me in watching my children, deal with this is how they have taken to this so strongly, and they've been enormously tolerant of a social disruption that I think many people would have expected children to fly off the handle with. They have managed with grace beyond comparison, in my view. So I think the messages are twofold: being clear that this is an infection. Fortunately, children seem to be generally better off than adults, but it's there, and that's the reason we're doing all these things that we're not normally doing, and how this is a sign of doing things for other people that we care about. And I think instilling that idea is just so important, as trying to understand some silver lining that we can get from this, because heaven knows, not only is that sentiment critical for this, it's critical for climate change. And so cultivating this understanding, I think, is an enormous opportunity.
Brian, how about the journey of your students at the University of Illinois in terms of their early approach to COVID and climate, which is further away? How have you seen them change their thinking about this as it's spread?
It's been an incredible journey for us. I'm teaching a class on pandemics during a pandemic. And so it's been a really surreal experience. We've been tracking COVID-19 since the beginning of the semester. One thing I'm very impressed with by this generation of college students is they seem to take the long view that climate change is a big risk to their health and the health of the planet. And so, I see an impressive level of understanding and concern about that problem. Watching them, sort of react to the COVID-19 pandemic as it, played out before our eyes. I mean, I think our generation, their generation, hasn't really experienced an event of this level of disruption in their lives. And I think you have to go back to, say, my grandparents' generation to really go to a time in U.S. history when people experienced major, ground-shaking events like this. So, I'm impressed by the poise with which this generation of college students has responded to this crisis. They're going to be directly impacted by it. They're graduating into an uncertain job market and an uncertain economy. Many of them are experiencing disruption in their plans. Students who are planning to take the MCAT so they could go to medical school in the fall are seeing MCAT exams postponed, and some of them are now considering changing their plans for timing of when they'll go to medical school because of that. So, I'm optimistic it's going to create a generation of public servants who are going to be, very aware of their role in our society and their ability to shape, future events in a positive way. So I'm encouraged by, how that generation is responding. I'm worried for them because I think they're going to face an uncertain future and challenges that I didn't have to face at a similar career stage. But I guess in terms of thinking about who will have our future in their hands, I like to think that this generation is up to the challenge.
Rob Gottlieb, other bright spots. Brian mentioned some bright spots there. Where's a lot of scare in this with COVID and climate. Where do you see some bright spots, some hope, some silver linings? Dare I say that phrase?
I see bright spots in the fact that there really are solutions available to the problems that face us. With COVID-19, the solution is not coming fast enough. We don't have the cure that we wish we had. We certainly don't have the vaccines, but we know what steps we can take to protect ourselves, our neighbors, our communities, and really flatten the curve and decrease the risk and hopefully save lives. In regard to climate change, I think one of the things that we need to tell ourselves and to tell others is that there is hope possible. Yes, we're on a dangerous path, and yes, we really need to make very sweeping changes to protect ourselves. But we do know what those changes are that we need to make. So first of all, we have to and we can greatly reduce our use of fossil fuels. We can cut back on the use of oil and gas. We can transform our transportation system. We can transform our buildings so that they're much more powered by the renewable energy that we need to have. That's so the reduction in fossil fuels is kind of the negative part of the solution. But I'm really very cheered by the advances in the technologies and the accessibility of renewable energy and energy efficiency. Let's remember that renewable energy is it's clean, it's safe, and it's like manna from heaven. If you'll allow that comparison, solar energy really is one of the ultimate mannas from heaven. And energy efficiency has been called the cheapest energy that you never have to buy. So there are paths forward. That to me is one of the silver linings. I think there are two other lessons or comparisons that we can make again between the COVID-19 pandemic and the threat of looming climate change. One is that I think that we're coming out of our current experience with the understanding that science really does matter. Science matters and doctors matter. We've got valuable, useful information and trusted messengers. And then the second thing that I think we're learning is that we have, as a society, we have to make our decisions about big threats that face us based on fact. We can apply what we know. We have the facts. We have the messengers, and what we have to do is turn that into the big levers for changing society, which is both personal actions and also our policy. And I think that if we do those things, if we learn from the experience at hand, we really can give ourselves a much safer, healthier future.
All those things. I'd like to wrap up by asking each of you, starting with Brian Allan, how are you coping during this time? Sitting, knowing what you know about diseases and the spread of pandemics. Maybe your knowledge comforts you, maybe it makes you worry. How are you coping with this field at this time where we're all cooped up and such a scary time?
Yeah, I'll say I feel very privileged to have this be less disruptive to my life than it is for others. I'm able to work remotely. I'm teaching my class online, which has been an adventure, but I'm enjoying it. I can do much of my other work remotely, and it, for me, has been balancing to think about this from more of an academic standpoint or more of a topic alike to topics I study. And as a result, I can kind of compartmentalize these events and think about it through that lens. So, for me, I've found it manageable. I'm still very worried about my loved ones and making sure that they're all taking the appropriate precautions, especially individuals who are in higher risk groups. So trying to use what expertise I have to relay to friends and family members in a way that they find palatable, my concern for them and my desire for them to, take as many precautions as they can.
Speaking of precautions, Ari Bernstein, are you wearing a mask in public yet?
I'm not. I'm not really going out much. So,
Mhm.
save for when I have to go to work, and then I get a mask.
Mhm.
We're abiding by the social distancing rules as best we can.
And Harvard Medical School has enough supplies,
Uh,
protective
well, the,
supplies?
the medical schools students are all learning remotely at this point. The students are not working in the hospitals. I think that the supply concerns are real, and we're going to do the best we can given what we've got. And I'm actually very grateful to many within our state who have worked tirelessly to try and do anything they can to get more protective equipment. I mean, I've seen everything, obviously from our governor, and you mentioned the sport teams, the Patriots and the Celtics, um, but even local hardware stores. I mean, I have a colleague who went to our local hardware store who just donated their entire inventory of masks to a hospital, to Boston Medical Center, and which is our safety net hospital. And so, people are stepping up, and I'd like obviously for protective equipment to fall from the skies. That's not going to happen, and we're probably going to be in the thick of this, as thick as it's going to get, at least here in the coming weeks. So, people are going to. What's astounding to me, and you asked about coping. I would feel similarly to Brian. I've really got nothing to cope with in the scheme of this. And I'm working in the hospital, but not nearly as much as lots of people I know. And people are throwing themselves in front of a virus that could really transform lives. And
You
and that's hard to compare with.
Knowing all that, do you ever get angry about the lack of preparedness? You were on a board at the CDC before, looking into these sorts of things before it was dismantled by the Trump administration. Do you ever get angry about what was dismantled, knowing that how we got here?
I don't have much time to be angry, frankly. It's not going to help me. It's not going to help anybody. I think ultimately, looking back on this, we're going to see that, it's not going to be easy to design a healthcare system in this country that's going to, whatever the supply is, it's going to be able to come to grips with an epidemic like this. Are we really going to have the excess capacity waiting at all times to deal with something like this or something worse? It's going to be hard to justify that on economic terms. Maybe we will. People tried for a long time. We're learning now about the government programs around ventilators and masks and how difficult it was with good brokers to try and get, the right pieces in place. These are, having supplies sitting around waiting for nothing to happen is generally in government parlance futile. Um, but maybe this will do it. But all of that just speaks to how critically important it is to use the knowledge we have to prevent this stuff in the first place. Because after the factness is really hard, really hard.
Which is, yeah, where we're kind of putting ourselves on climate is to set things in motion. They're going to be more expensive and more difficult to respond to. Bart Gottlieb, how are you coping? And how are you coping, and what precautions are you taking now in this time?
Well, I'm working from home, working remotely, and of course, relying heavily on the technologies that we're so lucky to have for connectivity, conversation with colleagues all across the country. Um, it's a frightening time. I think all of us feel that, and certainly for my family and for my neighbors, we're all taking the precautions that we can. The precautions are necessary. They also take their toll. Social distancing is necessary, and it's painful not to be able to chat with the neighbors over the back fence or hug my parents when I go by their house to drop off their groceries. But these are the
Mm.
things that we need to do. These are the responsibilities that we all accept because this is what we have to do to protect one another and keep ourselves safe and strong. I guess for trying to keep an even keel, uh, I try to get outside and walk outdoors and walk the dog and uh, wave to the neighbors from a distance. And I also take great strength. I derive strength from the examples of the people, especially the health professionals, but not solely, whom we see so bravely carrying on under these difficult and frightening circumstances. My heart really goes out to our fellow Americans and people all around the world who are unable to work and don't have an income and face really frightening prospects in terms of how are we going to proceed? How are we going to buy the food that we need? How are we going to pay the bills? How do we protect our homes? And so I really, I guess what I do is I take that in and I turn it into a rallying call. These are the problems we need to face. We need to make sure that we face these as a society. We need to watch out for everyone. We need to protect those who are most vulnerable economically and physically, because we really are all in this together.
Thank you all. On Climate One today, we've been discussing the public health connections between climate disruption and the COVID-19 pandemic. We learned that human encroachment on remote ecosystems, often driven by expanding agriculture, is contributing to the rise of new diseases. We also heard about medical professionals as messengers that climate change matters to your personal health. I'm Greg Dalton, and my guests today were Brian Allan, Associate Professor of Entomology at the University of Illinois, Urbana-Champaign, Aaron Bernstein, a pediatrician and interim director of the Center for Climate, Health, and the Global Environment at the Harvard School of Public Health, and Barb Gottlieb is Director of Environment and Health at Physicians for Social Responsibility. Podcasts of this and other Climate One shows are available wherever you get your pods. Please rate, subscribe, review. I'm Greg Dalton. Thanks for joining us online. We'll see you next time, everybody.